Hi and welcome to The Nation. I'm Gerard Ratnam. The Malaysian White Paper confronts crucial challenges in the healthcare system, including an aging population, non-communicable diseases, infectious diseases, mental health, climate change, biodiversity decline, and fee imbalances. It calls for transformative changes and involves stakeholders from ministries, agencies, private sectors and NGOs to gather data on healthcare system concerns. I guess one of the bigger questions is, we've got a plan now, and it's called the White Paper, and how is it going to go? We've got 15 years to see this through. Joining me in the studio is a senior medical practitioner and Health White Paper Advisory Council member, Dr. Koh Kachai. Dr. Koh, thank you so much for taking time off to be with us. Just so much to talk about. A lot in the news coming out, bits and pieces about the White Paper, and when I look at it, the proposed healthcare reforms aims, number one, to separate the roles of provider and purchaser of health services from the Ministry of Health. Now, I guess there's so many things to talk about, but we can start with gaps. What gaps did the Health White Paper address? And sitting on the Advisory Council, what were the ones that stood out to you the most?
Well, when you talk about the gaps, there's just so many that it's just impossible for me to enumerate them one by one. Mm-hmm. But the gaps are not only within, as perceived by many people, they think that the gaps is within the Ministry of Health alone, but it's not within the Ministry of Health alone. It is within the whole system, and that system is not the purview of just Ministry of Health, but everyone. Mm-hmm. So there were a lot of gaps which we saw that even if the Ministry of Health were to go about it, trying to patch up all the things alone, I think we will not go anywhere.
Mm-hmm. Now, you say it is important to raise public awareness about the Health White Paper, despite its acceptance by Parliament. And right. I think as we move on, we want to make sure that it's implemented and it's just not being paid lip service. Right. But why is it important to raise public awareness at this time? And how much do people know? I mean, I'm sure you guys did a sampling as to what people are talking about or what worries people have with regards to the healthcare system. Why is it important to raise public awareness at this point? And over and above that, when we raise public awareness, what must be the key focal point?
Right. To the last part of your question, the key focal point, there are so many focal points, but I think topmost on many people's mind would be the finances involved in healthcare. So this is what we are seeing many people talking about now. But coming back to the earlier part of it, mm-hmm. Just repeat, what did you say again?
Right, so we were talking about public awareness now.
Oh, right.
So, raising public awareness,
right.
Yeah.
So the reason why we need to raise public awareness, even though some people came to us and said, you people have done the job, now it's been accepted by Parliament, then why would you want to continue, talking to the public and all that? But the thing is, now we have got acceptance by parliamentarians, and hopefully it's a full bipartisan support. I mean, from what we can see, we saw that there was a lot of support, but we do not know as time moves forward. Now, the thing is, we are always worried that once it's accepted, and then things are, people will say, yes, it's already there. It may just be lying on somebody's desk, and like you say, somebody will just pay lip service to it. We are just worried about that. Right. And we need to keep on pushing so that if the Rakyat were to say that, yes, we need this reform, I'm sure the politicians will come forward and make a strong move towards reform.
Mm-hmm. Now, for public awareness' sake, I'd just like to go back, and I know this question is not in the set of questions I gave you, but I'd like to talk about you being in the Advisory Council or the White Paper Advisory Council. How many people are there in the council, and why did they pick you? Right. So, I mean, this is for public awareness. So, there's always a loophole for people to say, oh, I guess it's just a bunch of friends that got together.
Right. So there are 13 of us, and if you look at the people who are there, they're all from diverse, all very diverse backgrounds. And reason why I was chosen, maybe it's because I'm a healthcare practitioner, right? I'm actively practicing. And if you look at all the 13 members, every one of us, like I said, we are from different backgrounds. So if you ask why specifically me and not anyone else, you have to ask the previous minister who appointed me.
Right. So this was an appointment by the previous minister, not this minister. So this was just a follow-through from what the previous minister has put.
Yes.
So so some of us are under the impression that if something like this happens, it means those who were doing work previously are ousted, and then there's a new set of people. It's not like that.
No, it did not happen. Of course, we were worried that when the new government came in and with the new health minister, where would we stand? And would we be able to push the agenda for the health white paper forwards? But we are glad that the new minister saw that it is crucial for us to take up this issue, and she adopted the whole council to work together with her this time.
Now, why was a 15-year reform plan chosen in the health white paper, and what benefits are expected from this timeline? Did the timeline play a crucial role in whatever's being done?
Well, of course, because whenever we engage people, a lot of them are saying, no, this can't be done, that can't be done, or they wish for something to happen overnight. Example now, you see right now people are saying that the hospitals are overcrowded. They would hope that the ministry can do something so that the crowd will just disappear in the next month or so. They would have done some miracle here and there, but it's not so, because we are talking about reform to whole healthcare sector, and it really takes time.
Right.
Why it is divided into these three parts is that the first 5 years would be the time where we have these building blocks, right? We have to put building blocks in place, and whatever current programs which are ongoing, we need to see whether they are in line with what we are looking forward to for the future, and to add on to that. So this first 5 years is where we will start building all this. The second 5 years would be to follow through with it, and to see whether this whatever building blocks or whatever programs which we are adopting is feasible or not. And the final 5 years would be where we will start implementing and putting in the final stages. And even though we say 15 years, it may even go on up to 20 years, who knows?
Right. So a very important question came through from one of our ex-editors. He was the head of the business desk before, and he still does some writing on his own, and he sent me this. Mike sent me this. He said, one question is emergency rooms. They should be done immediately, yet people are complaining over delays in treatment. Long-term planning sometimes can be equated to a lack of immediate action when emergency departments are in most need to personnel, doctors, bed facilities, etc.
Right. So what we were talking about is why the long time period needed for this reform. And now what is being said is that we have got certain things which need to be addressed urgently. And if we were to go for reforms, what's going to happen? People can't wait. Well, of course, from what I can see, down on the ground, there are things being done. Of course, I'm not privy to all that because I'm not with the Minister of Health, but I can see that there are things which are being done to remedy certain issues on the ground. However, to look at the bigger picture, if we do not have a reform, whatever is being done now to rectify or remedy whatever issues we have now will be very, it won't be carried on for long. It will be maybe just a short-term measure. And after that, what are we going to do? We may end up with the same thing or something even worse after that.
Right. So MOH wants to remove itself from whatever that's happening, too many things, and just focus on policy and reforms and planning forward, isn't it?
In a way, yes, because throughout the years we realized that Ministry of Health has just too much of things on their hands, because everything comes within the gambit of Ministry of Health. They regulate, they purchase, they provide, everything is there. But having said that, a lot of people have come up to us and said, no, it's not feasible because there are many laws which needs to be amended in order to allow Minister of Health to sort of relegate or just let go of a lot of their responsibilities and just focus on certain things. Of course, this is a vision. That's why we always say there's a vision, and we hope that if we can go towards a total reform, there will be an improvement whereby Ministry may not let go of everything, but there will be a chance for coming closer together of the public-private sectors, and whereby Ministry of Health will play a more regulatory role rather than being in charge of services.
See, one of the questions that's always been asked, or something that's always been brought about for political reasons, so it will usually be the Ministry of Health is a gold mine in that there's a lot of money to be spent on procurement, on purchasing medicine, so on and so forth. Now, is the ministry or are we seeing an importance now to remove that part of the equation from the ministry so it can actually focus on being a ministry and not going out there to understand what medicines they need to purchase and so on?
Well, I think I will find it very difficult to answer that question for you because, you know, there are a lot of people coming up with a lot of allegations and all that, some of which may be true or some which may not be true at all. But let's just say that the Minister of Health should actually just concentrate on how to manage the health system and not just do what they are doing now, whereby they do everything. So they have to have a certain, what do you call it, they have to really get some duties back down to the providers, manage the hospitals and the public sector, and even their primary care sectors in the public sector I'm talking about. Let them do the work which is needed to be done. And I mean, instead of having a big brother to say that, you know, this is what you should do and all that. So some sort of autonomy for them to move ahead, but under the umbrella.
So we're looking at autonomy. Having said that, one of the bigger questions I wanted to ask was financial burden on individuals or people. You know, how much of a financial burden is this going to be for people? I guess we'll take a short break. When we come back, we'll find out more about the white paper right here on The Nation. I'm joined by Dr. Kokha Chai, who was part of the advisory council. We'll come back with more. Stay with us right here on The Nation. Thank you for staying with us right here on The Nation, Bernama TV. We're joined by Dr. Kokha Chai, who is here to talk about the health white paper, and he's a medical practitioner, senior medical practitioner, and is also part of the white paper advisory council. He's a member of that, and we're trying to get some information from him. Of course, I wanted to talk so much about, you know, how we complain that medicines are expensive and who's behind the purchasing and procurement of medicines, but I guess that will have to be a can of worms that will have to be open on another day. But let's talk about burden on you and me, you know, as people who use the healthcare facilities within Malaysia or government healthcare facilities. I guess the other problem is cost. While some people say, you know, we are not as bad as some countries, I think we can do better. Do you believe that we can do better in providing a service?
Yes, of course we can do better, but without the proper reform, I think it's an uphill task and maybe impossible task to be able to provide for everyone. There has to be a change. And the problem is that many people has come up to me and say, if we were to go for reform, what will the financial burden be on all of us, like what you have brought up just now, right? The reason why we're looking at reform is to allow equity in healthcare, right? And allow everyone to be, for healthcare to be affordable for everyone, and not, which many people do not understand. They keep on saying that, you know, the moment we go for reform, you're going to increase my fees and this and that, and we will be forced to pay out of our pockets for our healthcare services. We have to pay to the so-called fund and all that. But the thing is, we need to look at how many people can really afford healthcare at this moment of time, right? I wouldn't want to divide us into, you know, the B40s, M40s, or T20s.
Right, we try to move away from that.
Right.
But just to use this as a sampling, I can't afford healthcare. You know, I work on national TV and I cannot afford healthcare. So that would be a good measure to know how many people can afford healthcare in this country.
So it's because of this that we want the public to understand that we need to go forward with this reform. Do not worry about increased cost of healthcare or increased burden of healthcare on yourself, because if we can have a proper reform and a proper system in place, well, I think as we you know, as myself, when I age, I would not be worrying too much about healthcare. But now coming back to this, there are people who can't afford healthcare, and we know they're being provided for by the government. But then there are a lot as well who can't afford healthcare, especially when they need to go into the hospital, right? And many people are saying that they can buy insurance and this and that, but we know there are many people who can't afford proper insurance or adequate cover. And
correct. You know, and for the longest times, insurance have had a good time in this country. Yeah, and for us to truly want to change this, do you think it will also, and I'm not putting you on the spot here, but do you think this will also affect private healthcare, simply because once there's good reforms within government healthcare or public healthcare, it will change the game, and it'll even the playing field.
Right.
Are people, are practitioners, and are stakeholders ready for this?
Well, stakeholders who are comfortable in what they have right now will not want change. It's normal across the board, anywhere. Anybody who is comfortable will not want change, right? But the thing is, we are saying that if we were to go for a change, we are not going to be going for radical change overnight, because we need time for changes to occur gradually, which is why we talk about 15 years time frame, and maybe more than that. So let's look at it this way, because you mentioned about insurance. Because insurance, the model which they are working on right now, it will have to be changed if we were to go for a total health reform. But we cannot be having a system whereby we can just disregard the insurance plans or whatever companies which we have at this moment of time. But we have to have a system whereby we can still have a role for them to play, but as to how the role, what is the role that they need to play, maybe it may be a bit of the change there, but whatever it is, when we look at the total reform, we have to look at every stakeholder which is present there, and not just disregard anyone and say that we need to change this, and we will just remove all the other groups and all that.
Right. So how does the health white paper ensure accessibility to healthcare, especially for underserved populations, and more importantly, all our friends in remote areas of Malaysia?
Right. Yeah. Well, I think you have seen in the papers right now, it's a bit of an uphill task to try to have enough of not the physical facilities, but manpower in all these areas. And it's not only about doctors and all that. So it is going to be quite a difficult task to look into this. But anyway, it's already addressed in the Health White Paper. And as we move forward, we need to understand what is needed by these out of reach, hard to reach areas. Right. And people, when we talk about all this, the people tend to say, Sabah, Sarawak, but even in Peninsula, we have got certain areas which is hardly access. People do not have proper access to healthcare, because even the geographical areas, there are geographical areas within Peninsula itself where it's a challenge to reach out to. But having said that, I think right now what we have is actually the best we can do. We have got access to facilities even in outreach areas, but how to improve further. Right.
So with technology and with the dawn of AI and all that, we're saying that, this is going to be a game changer. It will change the face of the face of the medical fraternity, and what we used to know is now going to be different. Now, is this going to mean, if we utilize technology and innovation, does this mean the proposed reforms will quickly identify areas that are lacking and fill that up straight away, or at least in the working paper or in the blueprint or whatever you're writing to put forward? Do you think with these changes, if you put it on a playbook, will it work once it's out there on the ground?
If it's out there on the ground, why not? It will definitely work.
Now the problem is it isn't there yet.
Right.
Yeah.
Right. So it's not only about the Minister of Health. Right. Let's say we roll out telehealth or telemedicine and all that. What about IT infrastructure in the country? Right. Which is why we said this needs a whole of society and whole of government approach. Minister of Health can roll out anything they want, but without the other ministries, the other governments coming in together, we can't. Because like you say, I go to a remote area and set up all these systems whereby patients do not need to come and see a doctor physically, and we can have all these services for them. But if the infrastructure is not there yet, what can we do? So, which is why during the presentation of Health White Paper, we are saying that charge must come from high up, meaning that the Prime Minister himself must actually take charge of this. Health Minister can do all. She can have all the services or the facilities of the Health Ministry available to her. But like I said, this is even bigger than that, and without a proper direction coming from upstairs. So when
you guys or this whole group of members of the advisory council sat down, did you all establish which ministries segment into the other in helping the health ministry?
Well, I think every ministry should look at health in all their policies. Right. Because just look at local housing. You need to have proper housing for people, because if you do not have proper housing, people will not be able to have healthy lives and all that. Even when you look at the local authority, like we're in KL, DBKL, if they don't have proper parks, or even the transport ministry, if they do not have proper roads, accidents do happen, and that contributes to people going to hospital. So we need the whole government and all ministries to look at health in all their policies.
Now, the most important question for me in all this is, how am I going to be able to afford healthcare? Okay, so what steps are proposed in the Health White Paper for creating a sustainable healthcare fund and implementing a national health insurance scheme? The reason why I ask this and I say me is simply because I've had a heart attack before, myocardial infarction, and that doesn't allow me to have insurance. Now, that aside, I'm sure there are millions of different problems in the country that insurance companies can help sort out. Now, having said that, can we come up with something nationally for every Malaysian to be able to afford healthcare paid by some insurance scheme?
Right. That's why we are looking at a single health insurance scheme or a national health scheme for everyone. But it's easier said than done, because there are many people who will be looking at it and say, who is going to manage the fund, and how is the fund going to be disbursed, as we go along and all that. So these are the things which we need to look at, which was why we wanted Health White Paper to be approved, so that it would give us a chance, or rather not give us a chance, but to give the country a chance to go forward and look at how to establish such a fund for everyone. And the fear behind many people is that if there's going to be a fund, I may have to contribute much more from my pocket to the fund. But right now, even before talking about the fund, we are looking at how the government can increase the percentage from the GDP towards healthcare management. And as we move forward, then we will look at how to establish a fund.
Right.
And the fund is not going to be paid directly from individuals, but it would still be sort of like, paid for by the government, by the employers and all. That means there will be many, many different facets to it as to how to contribute to the fund.
Right. As one of the members of the White Paper Advisory Council and a senior medical practitioner, now I guess I'm going to give you this 2 minutes to help me wrap this up with a message to stakeholders, more importantly the people who are going to say yay to the Health White Paper. What would be your message to them? Because you say for years we've been only paid lip service.
Right.
What do you want to say to the government and everyone else who needs to make this happen at this point?
Well, for those who are in touch with the politicians, I think they need to push the politicians to do something about it. Of course, they have pledged that, or in Parliament to say that they support it, but as we move forward, if there are any programs or any plans which we need to engage people on the ground.
So they have pledged already?
I shouldn't use the word pledge, but in Parliament there were hardly any objections and it was passed through.
Right.
So not the word pledge. So anyway, right now it is being debated in Dewan Negara as we speak, and I hope that all will go well there. But anyway, coming back to the people, they have to push their own politicians to look at health in all their policy matters. And as people on the ground, they need to understand that health is not the responsibility of the healthcare providers or the Ministry of Health. Health is also the responsibility of the people alone. And as we move forward towards reform, we'll be pushing more and more responsibility of healthcare back down to the people. And they need to accept that they have to take proper care of their health in order for the system reforms to take place.
Right. Dr. Koka Acha is Senior Medical Practitioner and Health White Paper Advisory Council member, joining us to ask this very important question. MOH'S White Paper, a vision to future-proof Malaysians' healthcare? If it's so that this is the way forward, then we should not pay lip service to it anymore. We should really act on it and do something about it as soon as possible. Thank you very much for staying with us right here on The Nation Bernama TV. I'm Gerard Ratnam signing out.